Welcome to our step-by-step guide on prescrotal castration of a dog, a common procedure that helps control reproduction, reduce certain health risks, and manage behavior. Note that this should only be performed by a licensed professional under proper conditions. The process begins with preparation, where the dog undergoes a thorough health check, is administered anesthesia, typically a combination of injectable drugs and gas, and has an forecatheter placed for fluids while vital signs are monitored throughout. Next, the prescrotal area is clipped and cleaned with a surgical disinfectant to ensure a sterile field, leaving the scrotum unclipped to avoid irritation. A small midline incision is then made in the prescrotal skin, allowing me to gently push one testicle up through it, using a single cut method for efficiency. The testicle is pulled out, the gubernaculum is broken down, the spermatic cord is clamped and tied, off with absorbable sutures to prevent bleeding, and the process is repeated for the second testicle. The incision is closed with absorbable sutures in the subcutaneous layer, avoiding external sutures to reduce irritation, and the scrotum remains intact but will shrink over time. Finally, during recovery, the dog is monitored as it wakes from anesthesia, and owners should limit activity for 7 to 10 days. Use an e-collar to prevent licking. Watch for swelling or discharge, and consider a follow-up visit. This procedure, when done by professionals, offers long-term benefits for your dog's health. Consult a veterinarian for any questions or to schedule it. And don't forget to like and subscribe for more pet care tips. After the procedure, it's crucial to focus on post-operative care to ensure the dog heals properly. I recommend keeping the dog in a calm, quiet environment to minimize stress and prevent excessive movement, which could disrupt the sutures. Pain management is also key, so I typically prescribe appropriate pain relief medication tailored to the dog size and health status. Always follow the dosage instructions provided. Owners should check the incision site daily for signs of infection, such as redness, heat, or unusual discharge, and contact a veterinarian if anything seems off. Providing a comfortable resting area with easy access to water and food will help the dog recover smoothly, and avoiding baths or wet conditions around the surgical site is essential until it's fully healed.